You're from Birstapur.
Yes, that's my hometown.
Okay.
Currently, I'm staying in Delhi.
Delhi, okay. Scar revision. No. How did this happen?
I don't know, so बचपन में खेलते कूदते लग गया होगा. No idea.
ठीक है, हो जाएगा ये. Small process है.
Of course, आपके लिए small process है.
No, it's a small thing for you also. So we can do it at the local anesthesia. If you want, you can go back today itself.
So, like, I want to understand कि क्या इसका procedure है.
सर्जरी करके निकालना है, suture निकालना है.
मैं already airline में अभी मेरा हुआ है. और I have only 1 month.
That's enough.
You know, makeup and all it's all there.
1 month is a lot. And if you want, we can get rid of this also. Make it slightly better. This is like, you're going to get 90% improvement. And if you want to do this, you're going to get like 70% improvement. The reason is, this is already quite good in terms of the scar. And this is pretty bad. So the improvement is going to be like a lot.
So, अगर हम suppose आज कराते हैं, तो उसका कितने दिन के बाद क्या इसका effect, इसका look कैसा आएगा?
आज कराओगे तो I will do a surgery, remove the scar and get approximation of the normal skin. So, for example, I'll draw and show you, so you know what you're gonna get. Something like this is what your eventual result will be.
सर आपने बोला ये थोड़ा better है because इसमें hollow नहीं है उतना. This is still better.
Better है मतलब अभी better है. But इसका जो surgery होगा, that improvement will not be इतना कि जितना इसमें हो रहा है.
Okay, मतलब ये because ये बहुत ही
already ठीक है, काफी बेहतर है.
Okay.
It's like if you can only take a person to 9 from, this is maybe from 3, this is from 7. So what it means, improvement is less, right? Understand it? That way. If you want, we can do that. And you can see a scar here, faint one. We're trying to make, so this we cannot do surgery.
Yeah.
There's a faint line here. We cannot do that.
Okay.
So we get objective mission is to get these two into like that.
Yes.
Yeah. That's
what
it.
about this chicken pox? Can you see?
No, not a good idea to do surgery on that. That's what. Those are just you can do lasers.
Two, I mean,
I can do
mostly concerned about
those two I can do. Not major, it's minor.
So scar revision and then
you go back.
Stitch.
Yeah. Then you take the stitches on day 5. So if you want to come back, you can come back. You want to get it removed in Delhi, you can get it removed.
Okay, I can get it removed in Delhi also.
Yes, somebody could.
So what's the after procedure like?
Kuch nahi, then we'll give you scar creams. You apply scar creams. Okay.
And कितने दिन के बाद ये जैसे ही जब हमारा stitching हटेगा तो ये fine line हो जाएगा सर?
No, मैंने 1 month लिखा है देखो. Because it will be some swelling will be there, initially light red color will be there. Maybe even 2 weeks. But eventual healing takes a month generally.
ये बहुत ही delicate eye के
कुछ नहीं होता.
से कोई
सब कुछ delicate work ही है. Work तो delicate है, but surgery minor ही है. But इसके लिए भी लग जाता है मुझे almost 1 hour, 45 minutes. Because you know you have to very finely do it.
Of course.
But it's local
मैंने
anesthesia.
दिल्ली में वैसे पता करा था तो they said कि इसको करने के बाद they have also suggested the laser
that you can
so
do
that
if
to
you want.
reduce the
That is like to put laser on these areas or something. That you can do 3 months post surgery and all that. But direct laser is not going to give you improvement for these two. For the rest you can do laser.
So जब हम ये कराते हैं उसके कितने दिनों तक हम मेकअप या कोई फेस प्रोडक्ट नहीं यूज कर सकते हैं?
6-7 days.
Features
निकल जाएगा उसके बाद you can use.
और ऐसा कोई साइड इफेक्ट्स तो उससे कुछ रिलेटेड नहीं होगा.
What is the cost of this?
Cost I will tell you. I've written the procedure. They would have already told you, but if not, they will tell you the correct cost.
Okay.
And we need to do a blood test, because it's surgery, whatever it is, small surgery. It's not emergency. But then we can do it today, tomorrow, 1 year, 10 years, and any time.
How much time it will take if we did it
You can go back today only.
We can, get it and we can go. We don't have to stay.
No.
Admit होने का तो नहीं है ना.
you can go if you
No
want.
flight issue.
No flying issues. I might only put a tape there, a small tape. Even that, if you want, we'll be able to remove it just before your flight or something. You can go. It's not a problem.
और कुछ पूछना है?
Any other complications?
कुछ नहीं.
कुछ भी नहीं है.
No other complications.
No, I've seen you a lot of videos, so I'm comfortable.
Yeah, don't worry about it. It's very small.
Since you're still shooting, so I'm like अभी Insta पर वो डालोगे तो नहीं YouTube पे?
नहीं डालेंगे. बाद में आप जाने से पहले डाल सकते हो.
हाँ, नहीं अभी नहीं डाल
Tell this to anybody. Why you want to tell this to anybody? Company and all that.
Company won't recommend. They won't give leaves.
अच्छा.
हाँ,
So what type of company are you working now?
Air India.
So
ट्रेनिंग अंडर ट्रेनिंग है.
ठीक है. बोलना ही नहीं है.
हाँ उनको बोलना नहीं है बट इतना ठीक है. स्टिचिंग हमें बोलना पड़ेगा कि
ऐसे
स्टिचिंग आए.
कंपनी इसके मत बोलो. If you're an IT company, you can tell them. Air India में बोल के क्या करने वाले?
ट्रू है ना, तो मेकअप करना होता है तो स्टिचेस दिखते
तो नहीं दिखेगा ना. आपने बोल
चाहिए चाहिए होगा उसके लिए.
लाइन दिखेगी तो ज्यादा विजिबल नहीं होगा.
नहीं होगा. विजिबल होता तो मैं आपको बता देता. फॉर एग्जांपल राइनोप्लास्टी कराते तो मेजर सर्जरीज कराते ना, तो ऐसा नहीं हो सकता जैसे कि अभी मैं बता रहा हूँ आपको. जस्ट ट्राइंग टू गिव यू एन अंडरस्टैंड. दैट्स व्हाई आई एम सेइंग इट्स माइनर. आल्सो रिकवरी क्विक होता है. सिर्फ सॉफ्ट टिश्यू है. फाइन वर्क है बट रिकवरी क्विक है. कभी कभार फाइन नहीं होता वर्क, या इट डिपेंड्स ऑन कहाँ पे सर्जरी. बिकॉज स्किन में हीलिंग इज 7 days ओनली मैक्स.
7 days.
मैक्स 5 days में निकाल देते स्टिचेस. इसी थिंग हड्डी में करेंगे या वहाँ करेंगे आपको तो 1 महीना लग जाएगा.
और अगर यहाँ पे करेंगे तो आईब्रोज में
कुछ नहीं होगा.
इशू तो नहीं होगा ना.
दिखेगा ही नहीं वहाँ पे जो हो रहा है सर्जरी आपका बाद में. won't be visible at all.
So you're suggesting only scar revision surgery. यही आप सजेस्ट कर रहे हो ना मुझे.
और क्या करना है? See, I'm not somebody who will suggest all surgeries unnecessarily because these are all aesthetic surgeries. It depends on the patient's desire, interest, and the motivation.
True.
Actually, I can improve his nose also maybe, but doesn't mean you go and operate. Not required.
Not required.
It is only when the patient has a need or a desire for whatever reason, then we need to do it. It's not like mandated कि हाँ इसको भी improve कर दो, ये भी improve कर
Of
दो.
course.
ऐसा नहीं होता ना. Scar revision also is not bad for you now.
I know.
Because that's bothering you and because you're here, I'm telling you.
True.
Otherwise, I'm not going to tell you anything. Okay, fine, चलेगा.
मुझे भी नहीं कर रहा था जब तक लोगों ने बोला नहीं otherwise.
I'm just saying. These things are all. ठीक है.
The only reason I came because of course I've seen a lot about it in Delhi also, but I've seen a lot of videos on YouTube of yours and थोड़ा सा एक trust मुझे जो हुआ, that's the reason I came and I visited. Otherwise of course
Yeah,
like
yeah,
Delhi है इतना बड़ा है वहाँ पे सब होता है. But I was like ठीक है, it's all about you get that trust थोड़ा सा.
हो जाएगा. You don't have any medical issues that I should know of, right?
No, nothing like that. It's just मेरा concern वही है कि मैं कराती हूँ उसके 1 हफ्ते से almost मेरे को है कि मैं उसको hide करके makeup से फिर I can continue with my training and all. बस वही है.
आराम से you can continue. You can continue the training tomorrow also if you want. कुछ नहीं होगा. It's not like, see, generally, sometimes what happens, the worst thing is some bruising can happen. Because you're fair, and what happens, the bruising gets visible. That's the only thing that can happen. But even when you have a bruising, it's very rare with a scar revision. Even if it's in a worst case scenario, that disappears very quickly. So, and then that can be concealed easily with any cosmetics or anything for a time being. I might use some black stitches. So those will be visible, especially here. Very tiny like your hair, probably even smaller. When you go for removing, they have to do a good job. That's the only thing. It's not very easy to remove these stitches.
So I'll better come to you. Why would I
No,
go
I'm just saying,
somewhere else?
because you have to come 5 days later.
Traveling, yeah, not
So
possible.
you can ask someone near you कि मतलब ये हो जाएगा. You'll find out if they're confident and then if they can do it, it's fine. That's not too difficult to do. I'm just giving you options. इतना दूर नहीं आना है एक और बार. Doesn't make sense. ठीक है? So we'll still do some basic blood test. You know, they'll do that whenever you're ready for surgery. Talk to my team. They'll tell you the costing.
Yeah,
फिर
we'll do
जब
the
आप
cost.
हाँ, then once you are ready, then we can proceed.
How much time it will take to do
So maybe, like I said, 45 minutes.
45 minutes surgery.
Totally.
And blood test will we do on the day of the surgery or
Whenever
prior?
you want, yeah. If you're planning tomorrow, you can do it today if you want. If you don't want to do it tomorrow, it's just basic bloods we do because screening blood tests. That'll take half an hour or so. I don't need scans, I don't need nothing else. We'll take some pictures. That's it.
Okay.
ठीक है?
ठीक है.
चलो, bye. Darshika.
Thank you, doctor.
You're welcome. Take care. You're going to put a joke.
Thank you so much.
I'll let you know. I'll check for the cost.
Sure.
And everything. And I'll
Done. And
Thank